An international effort to contain an Ebola outbreak in the Democratic Republic of Congo. At least 80 suspected deaths have been reported and 246 cases. The World Health Organization has since declared the Ebola epidemic a, quote, public health emergency of international concern. Bringing in CNN's Larry Madowo in Nairobi. Larry, if you can start just by telling us the state of play here with this public health emergency.
The experts are extremely concerned and the region here on high alert after these 88 deaths from Ebola in the Eastern Democratic Republic of Congo. The CDC saying that there are 10 confirmed cases, but more than 330 suspected cases. And there's also been a case reported in Uganda next door. 2 confirmed cases in Uganda. 1 person died and was sent across the border. The other is receiving treatment, the government in Uganda tells us. And the neighboring country of Rwanda saying it is adding extra vigilance at its border checks, just making sure that this does not travel across the border. But the reason why experts are concerned, the first case was reported about a month ago, and that a 59-year-old man died from that. Now this huge outbreak in an area of the Eastern DRC where already it's suffering from major conflict and displacement, and that means people have been traveling quite a bit. That is why the World Health Organization has declared it a public health emergency of international concern, but falling short of declaring it a pandemic emergency. The Africa CDC is supporting the government of the Democratic Republic of Congo and of Uganda to deal with this. Here's what the director told CNN this morning.
We need to open borders. We need people to fly. But what we need is to make sure that we are screening each person. We are isolating those who are at risk, and we are taking all public health measures that can protect all of us. I think for now, we are on top of things.
That's going to be a major issue for a lot of countries if there are people traveling from the DRC or from Uganda, from the region, who might have been infected or who are directly affected. The CDC is saying it is helping relocate a small number of Americans who are directly affected. It didn't offer any more than that, but it says it's working with the interagency partners to make sure that it's providing support to the DRC to deal with this so that, viruses have no visas, or they do get around, and they're making sure that this is nipped in the bud.
CNN's Meg Tirrell is tracking this one. She's here with us now. What's the latest on this, and what are you picking up?
Yeah, so of course last week we were all talking about the hantavirus.
Yeah.
And so this came seemingly out of nowhere, and it caught a lot of people by surprise, especially from its sheer size at the time when we're hearing about it, and World Health Organization authorities are talking about it as well. So as you noted, there have been 10 confirmed cases, but more than 300 suspected cases, 88 deaths suspected to be from this strain of Ebola. And this is a strain that we don't often see. It's called Bundi-Bujo, and normally we see a different strain. 2 cases have also been detected in Uganda, which is in a neighboring country, including 1 death. If you want to see essentially where this is, it's mostly centered in the Ituri province in the northeastern part of the DRC. But we do have those 2 cases in Uganda, and there is a lot of concern about spread around the area. So you just mentioned the WHO has declared this a public health emergency of international concern. This is a pretty big deal. Okay. And just to give you an example of what that means, the previous times the WHO has declared that, this isn't an exhaustive list, but these are some that people will recognize. 2009, the H1N1
Meaning these are things
pandemic.
you've heard of and you remember. That's when they reach to this level.
Yeah, exactly. And of course, this is the previous time we had the largest Ebola outbreak in history, 2014 to 2016. That was in West Africa. Of course, these others. And what this declaration really means is that this is an extraordinary event and it has international implications. This doesn't mean it's going to be a global threat. Right. It just means that it has the possibility to spread across borders, which we have already seen, and requires international coordination to try to contain. Now, if we want to look at Ebola, there's been a lot of Ebola in the Democratic Republic of Congo, which is, of course, where this is happening now. Right now, we're talking about an outbreak over here. The colors here are important too because this shows that this is the usual strain that we see, Zaire Ebola, and right now we have this different strain, Bundi-Bujo, which is in the yellow, and we have only seen 2 other outbreaks of this strain before. And problematically, we have a vaccine for the Zaire strain of Ebola. We don't have one for this strain. And so therapeutics, vaccines, we're not relying on those like we have been able to before, even though typically the way to contain this is to try to do contact tracing. This already, we have more than 300 cases, more than 80 deaths. These are the previous largest outbreaks of Ebola. This was the one in 2014 to 2016, 28,000 cases, 11,000 deaths, and a previous one in the Democratic Republic of Congo as well. So this one is large. It's already larger than many outbreaks we've seen before, but it's not yet approaching those sizes.
I mean, let us please not reach anything close to that. What of the CDC response, the U.S. government response, and what do they believe is the actual risk to Americans?
Yeah, right now the CDC says the risk to the United States remains low. They have issued these travel warnings to the areas that are affected. So level 2 for DRC, level 1 for Uganda. So essentially be aware of this. There are screening methods for those countries, particularly DRC at the borders.
Yeah, they have exit screenings, right? Yeah.
Exactly. And it's not thought that Ebola spreads if it's not symptomatic. So fever screenings and things like that. The CDC also said, as you noted, they're sending folks, they have operations in those countries already. So they're trying to help with surveillance, lab efforts, contact tracing, efforts to control this. There are concerns that this is spreading in healthcare settings. We've heard of deaths among healthcare workers. They also note that they're supporting government efforts to coordinate the safe withdrawal of a small number of Americans who are directly affected in outbreak areas. We don't have a lot of information about what that means right now, or even if they're coming back to the U.S., they could potentially go to a different space. We also know that there are a lot of folks who are quarantining in Nebraska right now because of the hantavirus ship, who have not, shown symptoms. They have not been diagnosed.
And that is where that is where Ebola patients have in the past been sent as well.
Exactly.
Yeah. All right, Meg. Thank you very much. Super informative. Really appreciate it.
With me now is infectious disease specialist Dr. Celine Gounder. She has firsthand experience with Ebola as she deployed to West Africa during the 2014 through 2016 epidemic. Thank you so much for being here. First of all, remind us what this virus does to the body, the symptoms and the nature, the deadly nature of this virus.
Sarah, I think a lot of people think Ebola is like what you see in the movies, that your organs liquefy, you're bleeding out, and that is actually not what it looks like. Most patients manifest with a fever, perhaps nausea, vomiting, diarrhea is an important symptom. And what bleeding we see tends to be more along the lines of oozing around an IV if they have an IV, or traces of blood in vomit or diarrhea.
All right, so the WHO has now declared this Ebola outbreak a global health emergency. What makes this outbreak different or more concerning, if it is, than previous Ebola outbreaks, including the one that you were there to try and deal with?
Well, so first of all, this has clearly been going on for a couple months now. The fact that we're picking it up where there have been so many cases. But in addition to that, you have all of the factors involved in the West African epidemic, which is the worst we've ever had. So urban areas, migrant workers who are moving around a lot, cross-border. But in this case, we have additional factors. So you're dealing with armed militants in the area. There's a fight over access to mining. So many of the minerals that are used in smartphones and EVs, we obtain from this part of the world. In addition, you have the pullout of defunding of USAID. So USAID would normally have been paying for funding the workers who do things like contact tracing and safe burials. The logistics for pharmaceuticals, PPE, so your personal protective equipment, gowns, gloves, masks, etc. There's also a massive shortage as a result. And the U.S. has pulled out of the World Health Organization. So we have a lot of different factors that are conspiring to make this even worse.
I do want to ask you about how concerned we should all be about this. A lot of people were worrying about the hantavirus because of what happened on the cruise ship and people being deployed from there. What about Ebola and folks who are in other countries, including here in America?
Yeah, so I think a lot of people think virus, novel virus, deadly virus, it's all the same, and they're not. For example, when I heard about COVID late 2019, early 2020, when we started to hear the first reports, that had me terrified. Hantavirus does not have me big picture that worried. I'm concerned for the people who've been exposed on the cruise ship, but I do not think that's going to be a widespread outbreak. This outbreak of Ebola has me very worried. Because we're not responding quickly enough. You're talking about, again, massive urban areas in the region. Kampala, where there have been some cases. That's Uganda. So it's already spread over the border. Kampala is one of the biggest travel hubs in southern Africa. So there are a lot of factors here that are very concerning, not to mention that we have a huge multinational event coming up in the United States, the World Cup. You're going to have millions of people, many different cities in the United States. And I'm very concerned that we're not prepared. It's not that the risk is very high for this to create an outbreak in the United States, but I am very worried we could have a similar replay of what we saw in 2014 with a case, for example, at Dallas Presbyterian Hospital that resulted in infections of other healthcare workers.
I remember those times. Dr. Celine Gounder, thank you so much for walking us through all of that.